Hi, my name is Dr. Leo Trezon, and I want to explain the colonoscopy test to you. The colonoscopy test is a really simple outpatient procedure, and we do it on weekdays and occasionally on weekends. It's done for the purpose of identifying precancerous lesions of the colon, such as colon polyps or colon cancers even, and also to identify problems that the colon could be causing and making symptoms such as abdominal pain, diarrhea, or bleeding of the lower digestive tract. Most people who get it are over age 50, but some people get it even before then if they have symptoms for which we would need to establish a diagnosis of the colon. The procedure is done at an outpatient surgery center and typically takes about 30 minutes to do. You would arrive 1 hour before the procedure so that you could meet the nurses and the anesthesiologist. You should wear comfortable clothes, such as sweats, for example. And you don't need to bring any fancy jewelry, watches, or any expensive items that you don't need to carry around with you. Upon arrival, which should be 1 hour before the procedure start time, you'll meet the nurses and the anesthesiologist, and you'll fill out some paperwork before we start. We'll want to know your allergies, we'll want to know your medication history, your surgical history, and other factors important to your health. Then we'll have you change into a hospital gown. The nurse will put an IV inside your arm, and then you'll meet with the anesthesiologist to review your options for anesthesia, such as twilight or monitored anesthesia care, involving a medicine called propofol, which is usually what we recommend. The anesthesiologist will ask you questions about your heart, your lungs, and your cardiovascular fitness, and if you've ever had problems with anesthesia and your allergies, things like that. We'll also inspect your airway to make sure your ability to breathe is really good. After that, we'll start the procedure, and I'll have you sleep on your left-hand side for the procedure. You'll have pillows and gel foam supports around you, so you're really comfortable as you sleep. You won't be getting mechanical ventilation or any kind of general anesthesia where there's a breathing tube in your throat. You'll be breathing on your own, and you'll look quite peaceful during the procedure, but you're really deep asleep, and you won't feel anything and you won't remember anything from the procedure. When you fall asleep, I'll put a thin camera inside the backside into the colon, and I'll also do a careful inspection of the anus and make sure you don't have hemorrhoids or fissures or cuts. Then I'll put the camera all the way into the colon, all the way to the end, which is called the cecum, and then I'll try to peek into the small intestine to make sure you don't have ulcers, which we call Crohn's disease of the ileum. Then I'll slowly remove the camera, and I'll inspect for polyps and other abnormalities such as diverticulosis, colitis, ulcers, bleeding vessels, hemorrhoids, things like that. And if we do find a polyp or some irregularity, we either take a biopsy of it or remove it completely. Those biopsies are sent to a pathologist, which is a doctor that looks under the microscope and makes an interpretation of what the abnormality is. If there's a polyp, we remove it either with a forceps, which is a small little scissor, if you will, that cuts it off, or we put a lasso around it called a snare, which cuts it out from the bottom of it. Then we send those biopsies to the pathologist. When I take out the camera, you wake up instantly because the anesthetic is turned off and you wake up instantly. But you really don't remember anything, and it takes about 20 minutes for you to come to your full senses. We'll give you something to eat and drink, and then we'll have you change back into your clothes. We'll ask your family members or friends to come and see you, and then we'll all talk together about the findings from the colonoscopy. I'll write everything down for you that I saw, I'll explain it to you, and I'll give you pictures to go home with on the day of the procedure. Then you'll go home with someone else driving you. You cannot drive yourself, and it can't be a taxi driver or an Uber. It has to be someone that knows you and can walk you to the door and into your house. Later on that day, I'll ask you to not drive a car, operate heavy machinery, make important business decisions, such as signing a contract, Don't lift any heavy weights or play sports, and don't shoot guns. The next day, you're back to normal and you could do whatever you like to do that you normally do. After the procedure, you'll also be allowed to eat really whatever you like. Most people don't have any problems digesting anything right after the procedure. And in general, they feel really good and like they had a restorative sleep, because propofol, the anesthetic, is usually very well tolerated, makes you feel really good for the rest of the day, essentially getting you back to almost normal. You should know that the procedure is really safe, but every procedure has risks. The risks of colonoscopy include bleeding, infection, perforation of the colon, vomiting and aspiration into the lungs causing pneumonia, oral or dental injury if we have to help you breathe during the procedure, medication reaction to the laxative, medication reaction to the anesthetic, such as low blood pressure, high blood pressure, abnormal heart rhythm. You could also have difficulty breathing, and the anesthesiologist would help with that too. There could be an injury to the spleen, and the most important risk is something called missed abnormalities, or abnormalities that are missed. And what that means is, even with the best quality procedure, sometimes things are undetectable, such as a flat polyp hidden behind a fold. We will do our best to find every single polyp and every abnormality that's present in the colon, but no test is perfect. And it's really important to have a great clean out so that I could see the most things that are in there. And the way that you do a great clean out is as follows. On the day before the test, I want you to do a clear liquid diet. That means no solid food, just clear liquids. Things like water, Gatorade, apple juice, broth, and Jell-O are good ideas, okay? And drink a lot. You could work on the day before, you could do a lot of stuff, you don't need to take the day off of work. When you get home at 5 o'clock, I want you to drink a commercial preparation laxative. It's called Suprep. This is the one I usually use, but there's other ones that we use too. With Suprep, what you do is, there's 2 bottles on the inside. One is for the evening dose at 5 p.m. on the night before, and the other is for the morning dose, which is 5 hours before procedure start time. So at 5 p.m. on the night before, I want you to take this bottle and pour the contents into here. Then it comes up to here, and I want you to add a little bit of water so that you fill it to the red line. Then I want you to stir it and drink it. And then it takes about 10 minutes to drink it because it doesn't taste that great. It's not horrible, but it just doesn't taste great. And then after you drink it, you have to drink 2 bottles of water, 2 small bottles of water. This is 16 ounces, and I want you to do 2 of these 16-ounce glasses after you drink the bottle, okay? And that's your evening preparation. And even though this new preparation is a really small volume and really easy to drink, it's still very strong. And about an hour after you drink it, you'll probably start going to the bathroom. And you'll go to the bathroom a lot. And so much so that you might even have irritation of your hemorrhoids, and you might be sensitive in your backside. So you could consider using a baby ointment to the backside, or Vaseline, or Desitin cream to make yourself feel good from all the bowel movements that you have. Usually people finish going to the bathroom and getting all their contents out by 8 o'clock or maybe 9 o'clock. Some people maybe even later. But usually you're pretty done and you're chilling by 8 o'clock. Then you're hanging out, watching television, reading books, and then go to bed at a regular hour. You wake up 5 hours before your procedure, and now you're ready to do part 2. So you do it again, the same thing as part 1, fill with water, stir it, drink it, and then 2 more glasses, 2 more Arrowhead bottles or water bottles. And then the second prep tends to move through you much faster than the first prep did, because there's really not much left in there. It's just really cleaning the walls so that we could really see things well, and it's very important. After that, there's no drinking or eating for 4 hours before the procedure, and then just a reminder to come 1 hour before your procedure start time so that you're not pressured and rushed just before the procedure. And then this procedure is really not as bad as a lot of people say it is. The prep has become much easier to do, and the anesthesia has become really wonderful, and you sleep quite comfortably through it. Sometimes this procedure is done in conjunction with an upper endoscopy test, which is a camera that goes into the stomach and upper intestine and esophagus. And that's done to detect conditions of the upper GI tract, such as reflux, hiatal hernia, GERD, stomach ulcers, gastritis, duodenitis, celiac disease, or cancers of the upper digestive tract. And for that, you really should talk with your doctor or myself to see if you have an appropriate indication for it. We don't routinely do it. So that's the nature of a colonoscopy test, and I encourage you to talk to your doctor about it or myself, and I hope this video was useful. Happy to.